Epidural has already been documented as the mainstay or the main mode of pain relief in labour process. It has been there for almost 20 years. It's very good as a pain relief simply because the medication will be given continuously through a spinal place called epidural column. So the medication will basically surround the nerve area of the backbone, back area, and the medication numbs pain fibers, pain impulses continuously as long as the medication being delivered. So it's very good simply because we can start from the moment you're having contraction until you deliver the baby. So we do not need any additional medication. Therefore, it's advantageous. And it has minimum side effects, and any other side effects, like example, a drop in your blood pressure can be supplemented with IV fluids, or certain steps can be taken to minimize the complications. It's very good to have a good pain relief with epidural simply because you can take away the pain component and the mothers can simply focus on pushing down the baby in a healthier manner. You do not have to feel fear or anxiety managing the pain, because the pain is being taken care of by the epidural, and the mothers can concentrate on the other processes of enjoying the birth journey. Rare problems that happens with epidural when mother is being inserted epidural catheter would be how good is the pain blockade. Most of the time it works very well. Unfortunately, for under certain circumstances, some mothers may experience probably half part of their body numb, and the other half is numb well enough. So in that situation, maybe we need to reinsert the catheter. And for some pregnant mothers, after insertion it doesn't work at all. Under that circumstances, probably a reinsertion of the catheter need to be provided. For some pregnant mothers, they experience the initial part pain relief is very good, but as they bear down, the pain may shoot up. In that circumstance, in that situation, we may need to top up the medication to provide adequate pain relief. Generally, most of the time it works very well, but only for selected few people we get this something called inadequate blockade of the pain relief itself. Does it fail? Sometimes it fails because the catheter does migrate. Simply means the catheter does move, and it's not advisable to give higher dose to get complete blockade, because that can cause other side effect, which is a drop in blood pressure, and that can affect your baby. Some mothers are concerned, if I take epidural, can it affect the progress of my labor? Normally a labor process towards the end, when the baby is coming out through the birth canal, it roughly takes about 30 minutes or an hour, depending on mother's positioning. So someone on epidural, it can take slightly longer, 30 to 40 minutes, simply because it's entirely numb, the area. So some mothers may have difficulty in pushing down because the muscles are not that strong enough, and when that happens, the obstetrician normally would assist the delivery in using instruments like forceps or vacuum, and it's called assisted delivery. Yes, it affects the progress of labor in terms of sometimes some pregnant mothers who have difficulty in bearing down because they have numbness from the waist down onwards. So yes, it can affect the progress of labor.